Doctors, what is the weirdest anomaly you've ever found on or in a body? Story 1. A mummified fetus. I was working in Africa. Usually very stoic Congolese surgeons called me into theater gagging. The patient was an elderly woman with a protruding abdominal mass. When they opened it, they found that it was a long, dead, mummified fetus, which, as a result of an ectopic pregnancy, had somehow managed to both wall off after it died and somehow avoid killing the mother. Her body had encapsulated the alien tissue, and over the years, it had slowly eroded her anterior abdominal wall to the point where it finally caused her to have enough symptoms to get something done about it. It was horrific and the smell was worse. Happily, though, the patient survived the procedure and just left the surgical team with a memory. Story 2. Guy came in for an outpatient MRI of his cervical spine. Form where it asks if he ever had any metal in his body, specifically asks if any was injured by a metal object. He selected no. Same with a verbal questionnaire. Also, we do a keyword search in the patient's hard chart for the term foreign body in case it's documented. Nothing came up. He lays down and I start taking images while talking to him, though the speaker. During one of the image sets, he starts pounding on the inside of the scanner and screaming. Figured he was claustrophobic, so I stopped the machine and got him out. Immediately, he jumps up and starts talking nonsense, runs into the wall, screaming he needs to get away from the ocean. I call overhead for emergency room staff to come down and security as he's flailing, continues screaming and running into the wall before we restrained him. The staff rush down and he's talking a mile a minute and explaining how he is inside of the poster of the beach that covers the entire wall in the room he's in, scared out of his mind and hallucinating. Security restrains him, and he's taken down to get an x-ray of his skull. There was a BB in his frontal lobe, just enough ferrous metal left in it to travel a few millimeters in his brain. In the emergency department, trying to escape, and was very fast. While unrestrained, he got up, somehow convinced the guard he was better. Story 3. One of our cadavers had two spinal cords, aka split spinal cord malformation. Just a first-year med student here, folks. Unfortunately, it's against our policy for me to even take photographs, yet alone share them. One of our groups during our laminectomy, removing the back of your vertebra to expose spinal cord. Lab. Once they cut into the dura mater, the tissue that wraps around the spinal cord, noticed a spit cord in the thoracolumbar region, side by side. Our lead anatomist was very excited to see this and had the whole class come see. Apparently, it's not the most incredibly rare thing, but it is the weirdest anomaly I've seen thus far. 2. So a lot of people are mentioning spina bifida. From what I understand in my studies, that would be the result of bones in the spine, not directly. This was not what we saw. There were no signs of prior surgery or herniation of the lunges. Story 4. In an anatomy lab, my group's cadaver had died from systemic complications of stage 4 lung cancer. And when we got to the lungs, they were two rock-hard, necrotic, blackened masses that looked nothing like the other cadaver's pink and spongy lungs. My anatomy prof took one lung out and wrung it, resulting in this putrid black goo flowing out of the lung. As he was draining the lung, he mentioned in an Indian accent, This is what happens when you smoke. A few decades ago, a Bodhi's exhibit, Notelink, contains dead people, medical plastic-soaked mummies. My mom and I went to check it out. She was a registered nurse, now retired, and had to dissect cadavers in college in the 60s. We got to the lungs part. They had the usual healthy lung versus smoker's lung, which always looks back shriveled and twisted next to the healthy lung. My mom was telling me how when she was in school and they got to dissecting the lungs, how the smoker's lung would crackle and pop like Rice Krispies, and how even that at the time didn't stop her from smoking. She's quit since. This athletic guy overheard us. Dude was telling us about how he ran every day, and at the end of every run he'd cough excessively. He believed that this removed all of the impurities from his lungs, and therefore he could justify smoking a pack or two a day. My mom was like a no, but he was content in justifying his actions and wouldn't hear of anything else. I thought it was odd he came up to us in the first place. Later, after the guy left, she said once you become a smoker that It stays with you. Quitting helps, but you'll never get back to where you were before her dad died of lung cancer 20 years before. 18 years later, so did my Gma, even though she had quit. Story 5. She isn't dead, but this week saw a patient with endometriosis in her lungs. Somehow, womb lining cells had traveled to her thorax and colonized the lung. She previously had symptoms of coughing up blood while menstruating, but because the endometriosis was so severe, was on the pill to stop her periods entirely. Then she came off it to have a baby, and after the birth, with her hormones all over the place, she developed 2 pulmonary embolisms, blood clots in the lung. And a few weeks after that, 3 successive pneumothorax, collapsed lung. The womb cells had tried to shed and made a hole between the airways and the sac surrounding the lung, letting air escape. She's deciding now whether to let the surgeons cut out the part of her lung with atrial cells, to go back on the pill for life, or to have a full hysterectomy and remove her ovaries. Tough choice at 32. Story 6. Not a pathologist. Work in a coroner's office. On more than one occasion, we have directed a post-mortem on someone who has died abroad, often due to heart-related issues. I once got a phone call from the pathologist after he had opened the body to examine the heart. This person died from a heart attack, yes? Apparently so. You want me to examine the heart? Yes, please. Where is it? Some other countries routinely remove organs when they are determining a cause of the passing. Then the body is embalmed and sent back to their home country. We still often have to confirm the cause of death, so I've spent a lot of my time chasing missing organs around the world. Story 7, not me, but my boyfriend's mom, is a doctor for people with special needs. One of her patients, an older man with Down syndrome, among other diagnoses, appeared to have extreme abdominal pains that lasted for weeks. They did several tests and tried some medication, but the pain wouldn't stop. He also suffered from constipation and stopped eating altogether at some point. The source of his trouble remained a mystery for almost 2 weeks, and the doctors were starting to get desperate. Then suddenly, one afternoon, my boyfriend's mom got a call from her clinic. She's the head of the department, so they let her know when something important happens while she's not on duty, that this man had finally been able to go to the toilet, and among some stool was a blue latex glove. Over the following days, he passed about 20 of these in total, and he felt better, and luckily started eating again. Most likely, he had somehow been able to steal the gloves from the cleaning lady's cart and ate them without anybody knowing and seeing, causing the gloves to get stuck in his intestine while absorbing his digested food, filling up like little poop balloons in his stomach. This really is one of the weirdest stories I've ever heard, but my boyfriend's mom said he had been known for eating weird stuff. Like this one time he ate a t-shirt. Story 8. While working as a pathology tech, I began the post-mortem inspection process so the pathologist would have everything ready when I called him. The deceased had been admitted bowel resection and later passed. When I opened him up, the entire body cavity and every organ was covered in small tumors. Everything. I called the pathologist and he said he wasn't ready yet and asked how I had completed all the necessary steps so quickly. I simply said, I'm barely past the Y incision and I'm not comfortable with going any further until you get here. Story 9. Not a doctor, but my brother and I were the first for my mom's doctor. My brother and I are twins, but I was born a month premature. My brother was actually a few days overdue. My mom got pregnant with my brother, and a month or so later, she got pregnant with me. Her body released another egg despite her already being pregnant. Because of the way we were conceived, my brother shoved me up under our mom's ribs. Her heartbeat concealed mine, so a month before my brother's due date, the doctor finally realized that there were 2 of us. This was in 1985. Ultrasounds weren't as they are now. Edit, don't use Reddit at 2 in the morning. I forgot I could edit my comment. I put some more information in a comment that got buried. Forgot to mention that another sort of rare occurrence, and I was born breech. My mom told me that the doctor had to pull me out because I wasn't coming out on my own. To add to my mom's luck, I was sucking my thumb and tore her quite a bit because the doctor didn't realize my elbow was sticking up. Luckily for her, though, my brother had already been born. Story 10, I'm a funeral director. I haven't seen anything too anatomically weird, but I did have an innocent-seeming old man with a tattoo on his shaft. Also, we had an obese woman, and when we were embalming and bathing her, a sugar packet fell out of a fat roll. Just one of those little pink ones. It seemed like it had been there for a while. I used to work in the ER, and one time we had a young woman come in, maybe 22, who was morbidly obese. She kept gesturing vaguely at her lower abdomen, saying, "I can't see what it is, but something hurts." In the course of the exam, we had to lift her panties, the flap fat and skin that hangs down, fupa, if you will. As it was lifted, we found an abscess with a weird orange substance all around it. Long story short, she had dropped a Cheeto while eating, and it had gotten stuck in her rolls. It stayed so long that it eroded a hole in her skin. My sister still hasn't forgiven me for telling that story at dinner one night. Story 11. In the first year of veterinary school, we're required to do a dissection on a dog and can elect to do a cat as well. One of the groups in my class opened up the chest of this cat that had died of natural causes, only to see its heart completely swallowed up by the diaphragm. For those of you who don't know what I'm talking about, the diaphragm is a really thin muscle in the chest that is a main contributor to breathing. This cat was born with a hole in the diaphragm hernia and had proceeded to grow around the heart like a little tent, making the heart more pillar shaped than heart shape, and somehow managed to live almost to adulthood. So basically, the heart was half in the chest and also half in the abdomen, just casually brushing against its liver. Story 12. I work in orthopedics. The kid had a fracture we reduced in the office and splinted. After a few weeks with proper healing, he's transitioned into a cast. Usually we see them every week and re-x-ray it to ensure no displacement. First week post-cast application, the x-rays show two solid circular objects blocking the fracture. Turns out the 6-year-old was hiding 50 cents he stole and hid from his brother. Not crazy, I know. I just always found it funny how far siblings go to piss off the other. Story 13. When I was working as an ICU nurse in San Diego, I took care of a woman with Creutzfeldt-Jakob disease for a few days, the human version of mad cow disease. She was only 44 years old, lived in Mexico. Her husband was a butcher, and they owned a restaurant in Mexico. They had 3 daughters, 18 to 22, and were a really lovely family. It was really, really sad. My heart broke for them. There was nothing that could be done. My unit had a strict no more than 2 visitors overnight policy, even despite pleas given the situation. She didn't have much time left. So I did what I hoped someone would do for me. I told the family the bad news of the policy, and then gave them the good news that I would be pretending they were obeying it as soon as my boss left. The family donated her brain to the University of Wisconsin so they could study it. Story 14. Not a medical professional, but I have one. Bit of background info for clarity. I was born with a potentially fatal kidney condition and had a few close calls in my childhood. By the time I reached my teens, my doctors were really concerned that I would end up needing a kidney transplant. I even reached adulthood. Now my dad is a universal donor, so he volunteered to go ahead and give me one of his if it would even give me a chance. Doctors were game, and he had to get examined and stuff, only to find something really odd and kind of upsetting for both of us. Turns out that my dad was born with only one kidney, so that wasn't happening. Lucky for me, I ended up not needing a transplant anyways, but my dad was really upset about that for a while. Story 15. When I was in med school, I had a 3 years girl come in for a checkup. Was checking her heart, and it seemed a bit off. When I brought it up to the mother, she said that the girl had situs inversus totalis, or in other words, all of her organs were on the opposite side of the body, including the heart. When I checked the right side of the child's chest, the PMI, point of maximal impulse, was normal and the heart sound was normal. What the kicker of this girl's is that not only was this a very rare condition, she was the only person in the world to have the particular mutation. In other words, her mutation was rare, even among other people with situs inversus totalis. Edit. The condition itself is not that rare, but the particular mutation the girl had is. Story 16. Not a doctor. I have a friend who has an amazing medical history. 3 types of DNA malformations. He was conceived in his mother's second, much smaller womb. His mother didn't know until she was almost due because the womb had nowhere to expand. His ligament on his left leg wrapped his calf instead of going down to his toes. His left foot has 2 distinct forms of clubfoot. He has spina bifida. He has Klinefelters. He is an XX female or XY male. He was born with an extravestigial kidney, the stuff that protects your spine. He is 10 times stronger due to his weird DNA. He is missing a vertebrae. He had an experimental spinal surgery which was tried only 7 out of 8 times cases. He was the only one to walk afterwards. He was given shots of testosterone as a teen to make him have a male puberty. Now, many years later, this has given him prostate cancer. Testosterone blockers have now meant his Klinefelters have decided as a woman, and he now has knockers. He is okay with this since he is a magician that also does bearded lady gigs. There's probably more to his medical history, but that's all I can genuinely remember right now. He has been to patient/Dr. Soirees, where he walks around talking to doctors about how his existence disproves their medical theorems. Story 17, I'm a pathologist, and during training I was working with the local medical examiner and had a case of gunshot wound to the chest that penetrated the heart. However, no exit wound was found, and no bullet was recovered upon evaluation of the heart. An X-ray revealed bullet fragments within the major arterial vessels in the legs, which presumably occurred when the bullet lodged in the ventricular spaces of the heart, was taken up by the last agonal circulatory heartbeats, carried down to the lower extremities via the aorta through to the femoral arteries. Story 18 I commented on a post a week ago, so here it is. It directly applies to this post. My dad is a mortician, and sometimes when accidents happen, he shows up for the removal right after the coroner gets there. He told me one of the craziest things he saw was when he showed up to a construction site where someone was pressure washing out a pipe or hole of some kind. The operator was using had the nozzle back up somehow and backfired the rod that the nozzle hooks onto straight through the handle and into the operator's head. Ever since he told me that story, I hold the pressure washer sprayer, so it's not aligned with me at all, haha. Story 19, I asked this to an emergency doctor friend of mine a while ago. Patients come in complaining of severe abdominal pain. Nurses take vitals, ask questions, etc. Eventually, my friend sees her, and after a few questions, he has her lift her shirt. The severe abdominal pain on the chart was in fact due to a gash, so severe part of her intestines were sticking out of her. No one had noticed, and she hadn't thought to mention that her organs had started leaking out. In fact, she seemed just as surprised as he was. Story 20, Undertaker here. Seen lots of abnormalities, but afraid to be specific, as it might give away the identities of the decedents, as they are very specific. One that I can say is, once I did an autopsy on a person who had a history of various substance abuse. Upon opening him, we found the inside lining of all of his organs to be bright turquoise blue. From his trachea down to his colon was bright blue. It was a weird but welcome break from the usual red and yellow. Story 21 ago, I was doing a ride-along with a local paramedic EMS crew to recertify my EMT license. We got a call for transport from the hospital and directions to swap rigs to the bariatric bus. The driver calls on the phone to get more details and keep chatter off of the radio. We have a patient being discharged from the ER who is too obese to be taken home via another really available transport. Yay, a big fat guy. This will make a great story later, right? We get to the hospital and the paramedic goes in with the supervisor, while the driver and I swap rigs with the super A who brought the bariatric bus. Pretty similar to a typical box ambulance, with better suspension, a lower deck height, a wider patient area, a stowable ramp, and a worn winch, like on your buddy's Jeep. Up front, pull the patient in on the gurney. We wander into the ER, curious about the holdup, and wait near the nurse's station nearest his curtain. He's big, maybe 450 to 500, but surprisingly ambulatory, or at least standing. As the nurses finish up with him, everyone starts to prepare to get the big fella on the super gurney for the ride home. And then he turned around with poor, undersized hospital gown, hopelessly wide open in the back. What the hell was that between his legs? It looked like two watermelon-sized, fleshy cysts hanging down between his legs. The driver and said, "He's going home with tumors on his crotch?" The driver looked at me and chuckled and simply said, "Not tumors." Story 22, my girlfriend is a dental nurse. She's only been working for a year or so, but she's already seen her fair share of weird stuff. So anyways, a dude comes in and says his teeth hurt really badly. So she and the dentist have a look around. They tell the guy that everything looks in order, but he insists that there must be something wrong. After double checking again, they can't find anything, but the guy insists, so they send him to get x-rayed. They look at the results and, well, his teeth are fine, but his jaw is perfectly broken in half along the middle. The only thing keeping it in place being the flesh around it. After some coaxing, the guy says that he got into a bar fight and got hit across the face with a baseball bat. But he didn't think it was that serious or that they would find out. Needless to say, they sent him to the hospital instead. I don't know why, but the thought of your jaw getting broken along the middle is really discomforting. Oh, and there was also this other time where they found a huge fly between a chick's teeth, and the patient hadn't even realized it was there. Story 23, I used to teach human anatomy. The weirdest cadaver we ever had came in with the cause of death listed as chronic obstructive pulmonary disorder, very common for our cadavers. Once we opened him up, we discovered a lot of weird crap. He had a baseball-sized tumor right at the curve between his ascending and transverse colon, which messed up both sections. His liver was malformed and tilted posteriorly. We never found his gallbladder, but there were still cystic ducts, so I'm not sure if the tumor wrapped around it or he has had it removed. He had a number of cysts on his kidneys, including once the size of an overfilled water balloon that was filled with dark green fluid. The kicker, though, was a massive aneurysm at the end of the abdominal aorta. It was the size of a duck's egg. It was so big when I first saw it, I assumed it was a tumor on his spine and not an aneurysm. It was also full of plaque, like a centimeter thick, on the entire arterial wall. The problem with getting cadavers for teaching is that we get limited medical history. There was a lot of shrugging from me when my students asked why something looked weird